The community pharmacy model being implemented by the Institute of Human Virology Nigeria in areas with high HIV burden is to improve access to antiretroviral treatment by people living with human immunodeficiency virus. An estimated 3.5 million people are living with HIV in Nigeria, and less than 1 million are on therapy. Many Nigerians live in rural communities and travel long distances to go to hospitals. Some drop out of treatment due to this difficulty. Therefore, this model takes patients' treatment to pharmacies in their communities to address this challenge. Another challenge of the ART program is overcrowding of health facilities, which affects adherence to treatment and results in patients drop out from treatment, which leads to waste of resources and treatment failure.
And now, in order to promote quality of services, what the Institute of Human Virology has done is to look at quality from two perspectives, from the patient and also from the quality service providers. From the patient is to take the services close to where they are. And in our community here, the patent medicine vendors have been found to be one of the first health-seeking behavior centers for most people.
In this model, patients who have been receiving treatments for more than 6 months are seen to be responding to treatment without complications, and provided they are not pregnant women, are referred to community pharmacies of their choice, which may be close to their homes, to receive drug refill.
This reduces the logistical challenges of going to the facilities to pick up drugs. The reason why this has become very important is because patients are facing a lot of challenges in terms of transportation, and the flexibility we have in our budget allows us to be able to do that adequately. And we've been able to do this because our funding agencies recognize the fact that we need the flexibility, and they have given us those flexibilities.
The community pharmacies involved in this model are registered and are recognized by the government. These pharmacists are trained on HIV treatment, adherence, pharmaceutical care, pharmacovigilance, drug distribution and storage, counseling, monitoring the success of treatment, and other patient care. They are adequately provided with resource for effective service delivery and communicate regularly with the patients and the referring hospital.
We've been able to scale up treatment. You know, when patients receive therapy in their community, it means that the hospitals are being decongested to create room for more people to be recruited.
8 secondary hospitals are participating in the implementation of this model. Over 30 registered community pharmacists have been trained, while more than 250 people living with HIV have been referred to their preferred community pharmacies as a result of this model that just began in 2016.
Okay. Actually, I think that community pharmacy is helping, because initially when I used to come here, I would spend a lot of time because of the crowd. Many people are around. Before you come to your turn, it will take time. At times, the whole day. After here, I will not go to work again. It's a great problem for me. But this community pharmacy, when I go there, anytime I go there, in fact, it was very friendly.
The community pharmacists refer the patients to the facilities for viral load tests and for other laboratory and clinical attention. Patients can receive drugs at these pharmacies even during weekends.
It forms a family quorum between you and the patient. When they come, they open up easily to you and they have time to talk. Unlike if they are crowded in the hospital, so availability of time, good pharmaceutical care is sure. Most of the patients that came here testify to this, that the program is an excellent one. They enjoy it, and there hasn't been any complaint from any one of them.
Healthcare workers say that the model has reduced their workload, enabling them to give quality care to patients. Patients have been helped with the community approach. The sustainability of this model also makes it preferable. The overhead and human resources costs are lower because the pharmacies are much smaller than clinics and hospitals.